funded by the CDC, a $7.7 million study that will look at immunity persistence and how it is that these groups of individuals, whether they have or have not been exposed to the virus, how they're performing over time, and we'll talk about that as well. But among the new groups that are included are educators, child care workers, agriculture, grocery, and food service workers, hospitality employees, solid waste collection workers, transportation service workers, members of the National Guard, and several other groups. So we're excited. Those groups are now able to go online and register for this test. Again, going to the website that is listed on the news release here. And I will now turn this over to Dr. Deepti Bhattacharya. He is an associate professor with the College of Medicine Tucson's Department of Immunobiology, and he will explain sort of the value of how it is this expansion of testing is going to help answer some of the key questions that antibody testing can answer. And then we'll transition to a statement by Michael White, who will talk a little bit about the partnership here in Maricopa County, where obviously the largest populated county in the state, where we hope to have a lot of participants in the testing. And then we'll go to Dr. Burgess, who will talk about the study. So, Deepti?
Okay, thank you, Mark. So, as Mark said, my name is Deepti Bhattacharya. I'm an associate professor of immunobiology, and my lab was heavily involved in developing the test that's being announced and expanded today. So, what I'd like to do is just to take a couple of minutes to tell you about what the test is, what it measures, and how our test performs, and some of the more specifics. So I'm going to start off with sort of the bigger picture of what it is. There are a few different types of tests that look for the SARS coronavirus 2. And so there are ones that look for viral materials, and those are really designed to tell you whether or not you have an active infection and you might be contagious. The antibody test is a little bit different because we're not looking for the virus itself. What we're looking for is an immune response against the virus. So when you get infected by something or vaccinated by something, your immune system starts to develop proteins called antibodies that stick to different parts of the virus. And so what we're measuring are those types of antibodies that could conceivably provide some degree of protection should you get re-exposed again. So our test is a little bit different than some of the other tests that are out there, and there's a few reasons for that. When we began this testing back in May, the caseload in Arizona was fairly low, and so there's some special considerations you have to build into your test to make sure that you don't call someone as positive when they're not really. So it's called a false positive. So if the state only has, say, 1% of people that are positive, even if you have a 99% specific test, that means about 50% of the time you're wrong. So that's something that we really needed to guard against. So the way that we did this is we picked two different parts of the virus and are looking for antibodies against both. So our test is such that two different independent tests both have to be right in order for us to call you as positive, and we're pretty confident in these results. We've done a lot of analysis of the first 6,000 people that we've tested in Pima County. And again, these are results that come back from May. Only about 1% of them were positive. And so that was 61 that were positive. And I think the real key thing by our test then is that we went back, took those samples back into the lab, and then really tested those antibodies to see if they could prevent infection in the lab. And so by those tests, we have 60 out of 61 that showed antibodies that prevent the viral infection. So we're very happy with that test. So the false positive rate is somewhere between 1 in 5,000 to 1 in 10,000, which is really good. Now, some of the key questions that come of that are, what do we do with the information? Some of it, of course, is to get ourselves a handle on what the exposure, the previous exposure has been for people in some of these higher risk professions. And Mark announced some of those that we're expanding to today. So the advantage of the antibody test over some of the viral tests is that the direct viral tests, they're there for an active infection, and once you clear the infection, they're not there for very much longer. The antibody test, and this will be something that Dr. Burgess will talk about, the antibodies persist, at least in our hands and our test, they persist for months. And so they allow you a nice window cumulatively to see what the exposure rate has been in a given profession. So that's certainly one thing, is basically getting a sense as to what are the most vulnerable professions, what more do we need to be doing epidemiologically to protect these high-risk groups. As you're all aware, the caseloads are really spiking in Arizona, and a lot of the hospitals are also looking for donors of what are called convalescent plasma, antibodies that can be given to people who are sick and end up in the hospital. From research standpoints, we're also very interested in trying to figure out, how much is protective, how long these antibodies persist. As I said, we're pretty sure that they last for at least a few months, perhaps in contrast to some of the things that you've been hearing. But then how much they last past that, how many you need to prevent a subsequent infection, those are all really important questions that we just don't have the answers for. I think that's all I have before I'm going to set it over to Dr. Burgess, who will talk about some of the specifics of.
Let me go ahead and first pass it over to
sorry.
Dr. White here.
I'm sorry.
As I mentioned, one of the important parts of this is to actually have the local partners across the state. In all 15 counties, we have a partner who is helping us implement these tests on behalf of the state. And so here in Maricopa County, we're working with Valleywise, and Dr. White will make some remarks.
Thank you, Dr. Michael White. I am the Chief Medical Officer here at Valleywise Health. Valleywise Health is honored to be able to participate with the University of Arizona in this important work. We continue to learn and build knowledge around COVID-19 disease and how it affects the various patient populations. By being able for us to collect additional samples, we really fulfill our mission as an academic healthcare organization. We want to be able to be part of the solution that generates this knowledge that we need to better understand this disease, better understand the treatment of this disease, and help us then build our effective response as we continue to see the cases rise in Arizona, across the country, and across the world. So it's important for us to be able to give back, to be able to provide this access, and really help us generate this knowledge that will help us benefit the treatment of our patients here locally, but on a more global scale. We're very grateful for the opportunity to be able to participate, to be able to have this access and provide this access and this material to this very talented clinical team and research team that will be able to answer these questions that they put before us to really guide us through this continued pandemic. With that, I'll turn it back to Mark.
Thank you. So as Deepti mentioned, one of the issues that still is unresolved because of the pandemic has not been with us that long. It's obviously a novel coronavirus. Is what is the long-term effect of this? What do we know longitudinally? And Dr. Jeff Burgess is sort of an expert in longitudinal studies. You may know him previously from work he's done with firefighters across the state and the nation, testing various effects of potentially carcinogenic materials that they're exposed to. So he is the perfect person to be able to set up a study on behalf of the university. As I mentioned, it's a $7.7 million CDC-funded study. It will take a year-long look at what has happened to people who have been exposed versus those who may have not been exposed. And so I'll invite Dr. Burgess up. He's with the College of Public Health in Tucson, and we'll let him make some remarks as well.
Thank you, Mark. So it's a pleasure to be able to speak with you today. As Mark said, my name is Dr. Jeff Burgess. I'm the Associate Dean for Research at the University of Arizona Mellon Enid Zuckerman College of Public Health, and the Principal Investigator, so it's kind of like the leader of the Arizona Heroes study. Arizona Heroes is a study of COVID-19 in healthcare workers, emergency responders, and other essential workers. As Mark mentioned, it's supported by a $7.7 million grant from the Centers for Disease Control, or CDC. We are looking at these particular populations because they're all at high risk of exposure to COVID-19. Some of those are pretty clear. For example, if you're a healthcare worker or an emergency responder, you can be exposed directly to a patient that's COVID-19 positive. For some frontline workers, they're going to be interacting with the public very frequently, and some of those members of the public could be positive for COVID-19 as well. And then for other essential workers, they may work together, so in close quarters for prolonged periods of time, and if one of them is sick with COVID-19, it puts the others at very high risk as well. So one particular component of our study that's special and different from many of the other studies that are out there in the U.S. is that half of our 4,000 participants will have to have had previous COVID-19 infection. And the reason for this is that the most important question that we need to answer is, how durable is that immune response to COVID-19? In other words, if you have it once, how long will it be in months, or could be years, until you're susceptible to another infection, a reinfection? Now, we're going to answer that question in a couple different ways. One is we're going to use the same type of antibody test that Deepti was mentioning to you, those diagnostic antibodies, and also the neutralizing antibodies, those that prevent the virus from replicating. And when someone comes into the study, we'll do a baseline serology, and then 2 other times over the course of the year, we'll get repeat antibodies. And we'll see whether those levels are staying the same, whether they're going down, as often does happen, and we will understand more about this longitudinal or over time changes in the antibodies. Now, to determine whether someone got either an initial infection if they hadn't had any before they came into the study, or a repeat infection if they already had COVID-19, we will be doing weekly nasal swab tests. Now, our research team will provide the material to each of the study participants, and weekly, regardless of whether they have symptoms or not, they will do a nasal swab and they will send it to a central location that's been established by the CDC, that is a CLIA-certified laboratory that does very fast, high-throughput testing, PCR testing for active virus. We will get those results back and we will let the participants know whether they have COVID-19 at any point during the study. And they will use that information, obviously, to take appropriate actions to protect others. Now, with that information, we can tell a number of different things. First of all, how frequently does reinfection occur? How long is it until reinfection can occur? When you get a second infection, assuming that people get it during our study time period, is it less severe, as severe, or more severe than the initial infection? So they're all questions that we can answer with this. In addition, by looking at both groups, both those that came in without COVID-19 infection and those that already had it, we'll be able to look at occupational risk factors for infection. For example, what type of personal protective equipment were they using? What were their workplace protocols to help prevent infection? So all of those things. Now, a really important part of this, and the reason that we're talking about it together today, is that most of our study participants will come out of the antibody testing initiative. When they go into that, they have a chance to say that they're willing to be contacted for additional studies. So we will take those individuals that went into the antibody testing initiative, said they're willing to be a part of another study, and we'll ask them whether they'd like to participate in Arizona Heroes. Everyone who's seronegative, which means that they didn't have antibodies against COVID-19, all of those individuals, the half of our study population, will come out of the antibody testing initiative from that. Many of these seropositives, people who've had antibodies against COVID-19, will also come out of the antibody testing initiative. But we will also be reaching out directly to all the groups that Mark was talking about before, all the essential workers, healthcare workers, first responders, and we'll be asking individuals that have known prior COVID-19, either through antibody testing, from another serology center, or perhaps from the nasal swab testing or saliva testing more recently, and seeing if they want to participate in our study as well. So if anyone's interested in that, the contact information for Arizona Heroes is in the press release, both our email and phone number, and we hope to have a website up pretty soon at the university as well. So I, again, appreciate the opportunity to talk with you all today and look forward to the questions that you have.
So at this point, we'll just open it up to questions. I just ask any of the folks to direct them to somebody, and they'll move toward the microphones.
Okay.
Yeah, so I just wanted to double check. So you're hoping to test 250,000 people, but just 4,000 will be part of the study, is that right?
Yes, so the antibody testing initiative has a goal of testing 250,000 different individuals in the state. But we are going to be only looking at 4,000 of those. Half will be seropositive and half will not have had evidence of previous infection, and following them forward for the year. The big part of the study is really these weekly nasal swab testing. So that's, they really want to know whether someone has an infection or not, because not everybody knows that they're infected, as you know. So some people are asymptomatic.
And those weekly nasal swabs, do you do it yourself, or do you have to go somewhere to do
That's a great question. You'll do it yourself. We'll have videos that we've worked out with the CDC to train people how to do it effectively, and we feel very comfortable with those. And then individuals will send those directly to Marshfield Clinic, which is the location where CDC is doing all of their PCR testing for COVID-19.
Thanks. And the testing statewide, is that like in Tucson, Phoenix, Flagstaff? Is it also in rural areas where these essential workers can get tested?
Yeah, so the testing is available in all 15 counties. There's, when you go onto the website, which I have here somewhere, COVID-19 antibodytesting.arizona.edu. It's there on near the middle of lower third of the news release. You will go through a process as a participant once you find that you are eligible, and you pick your county, you pick your location within that county, and then it walks you through the process of how you get your test.
And for the Arizona Heroes, we will have availability for repeat serology testing all throughout the state as well.
I apologize if we went through this. How soon before you have enough data that you can draw some conclusions about whether or not one can get sick again? Because we're obviously, by January, February, I'm sure that's going to be a much bigger question.
It's an excellent question. We expect to be enrolling participants in the study even by the end of this week, and then rapidly increasing our number thereafter. So we hope within a few months to be able to have everybody in the study.
So but you wouldn't have enough data to draw conclusions for a few months?
I think that depending upon how durable the immune response is, how long you stay immune from reinfection, we will be able to see that either in the first several months of the study or perhaps by the end of the study. If people have a durable immune response for over a year, then we will not be able to see that because our study is only for 1 year.
Right. And then, Doctor, why is it so hard to detect this particular virus? Same family as the common cold. We've been dealing with COVID viruses and coronaviruses for a very long time. I'm sure you've been gobbling up information on this thing. What makes this one so difficult still?
So when you say detect, you mean the immune response?
The immune response.
Yeah. Well, it's different. I mean, I think if you look at the nucleotide, the genetic sequence of this virus, it's quite a bit different than the ones that affect us year in, year out. And so there's 4 sort of broad strains that are responsible for somewhere around a third of colds. And this one's pretty different. I mean, really the most similar one is the first SARS coronavirus that emerged in 2002 and 2003. And that's not something that any of us have really been exposed to. So I think we have to think about this as really a different thing altogether. It is true that there are some weakly cross-reactive things that part of our immune system can sort of detect some parts of this virus, and I think it's still unclear how important that is. It's clearly not enough to protect us from symptomatic disease. You know, maybe some people who have more of it are a little bit less susceptible than those who don't. But I think it's fair to say that this is essentially a new virus that none of us have seen before, and I think that's the reason.
And have you? I'm sure you've been looking at this thing since the beginning. Has it changed? When we talk about mutation, has it mutated? Has it changed? Why is it so difficult to develop an antibody test or any test in a quick? The big question is, why don't we have fast, reliable, always available testing across the country all the time right now?
Yeah, I mean, I think the imperative for that is really for viral testing, for active infections, and I'm actually pretty happy with the quality of those tests. And there's some very rapid ones that are called antigen tests. I'm really excited about those because I think those will give you results in 10 minutes. You know, the antibody test, I'm not sure that the imperative is that we have to have this immediately because it's a different question that you're asking. You know, if you get it in 5 days versus in 10 minutes, I'm not sure that has a whole lot of impact on actual public policy. I'm sorry, I forgot the first
But
part.
has the virus changed?
Yeah.
As you're developing this
Yeah.
even
No,
antibodies,
very
has
little.
it changed? Why so tricky still to do a proper antibody test?
I think it's not. It's mainly a matter of logistics to actually get those antibody tests up. I mean, some of these point-of-care things, there are just some physical constraints as to its sensitivities and specificities, and a lot of these things haven't really been through the full vetting process. I don't think it's actually that hard to get the
So the
antibodies.
high false positive rates that we had early on, that was just tests that were rushed out there too quickly,
That's right.
and that's fine.
That's right. And so as far as how much it's changed, reassuringly very little. I mean, there's one change. I think scientists are still debating the impact of that change, whether it means anything or not. It's definitely not flu. It's not HIV. It's not hepatitis C. It's not mutating nearly as rapidly as any of those viruses. So, for all those reasons, I'm actually pretty bullish on a lot of the vaccines that are in development right now.
And this also is a question for Dr. Bhattacharya. You said that your early research indicates the antibodies persist for months. What do you mean by months? Is that like 2 months, 6 months?
So we have a lot of data between, I'd say, day 40 and day 60 after symptom onset. And we really don't see very much decay at all. It's pretty flat. We don't have nearly as many data points after that. What I'll say is that we have some out to about 100 days, and we still see plenty of antibodies, and they seem to have lots of neutralizing antibodies. So I know that there's been a lot of concern over some things that have been reported in the news media. We don't agree with those findings.
And how much does antibody research and testing sort of cross over with vaccines? And how important are those two?
Yeah, it's an important part of testing how well a vaccine works. And I won't get into all of the geeky specifics of that, but the very first thing you need to do when you get vaccinated is to see if you're starting making antibodies. And so it's in many ways that the infrastructure is very much the same.
I apologize if we already prefaced this, but what is the response time and test results for either the antibody and then the study? We said it could have been any time after because they're getting tested weekly, right?
Yes.
Yeah.
Yeah, I mean, so if you're negative, we try to get that result back to you within about 5 days. One of the things about our test, again, because we check our own homework by doing 2 different tests, and they both have to be right. If we suspect that you're positive or if you're sort of in that gray zone, then it can take a little bit longer. It can take up to 10 days post-test.
And then they're sent over to the study.
I'm sorry?
And then that's sent over to your study?
The day he gets the data in real time.
We look, if an individual is willing to be recontacted,
Okay.
then we will get, within the antibody testing initiative, there's a questionnaire survey at the beginning, and that's one of the questions. Then we will follow up with them. Actually, for our first test, we'll repeat it again, not that it's necessary, but the information that goes into the antibody testing initiative has a lot of privacy issues associated with it, as you might expect.
Yeah.
Therefore, rather than getting those results, which would go against the privacy, we're just asking people to retest, and so we'll retest the first and then do 2 additional ones over the course of a year.
Just the preliminary test to get started and engaged in your study.
And so, because we want half of the people to have had previous infection and half not,
Okay.
that first antibody test result, we won't actually know the details of it, but the person will be able to tell us whether they were positive or negative.
I see, thank you.
Sure.
Can you go into a little bit more detail about how you're going to pick those 4,000 people that you're going to test long-term?
That is a great question. So this is something that we've worked with our statisticians, with representatives of the CDC to determine. And what we have is a study matrix where we look at different groups. So, for example, we're going to have probably about 30% of the individuals, roughly, perhaps up to 40% being healthcare workers. And those could be individuals that work in hospitals or in ambulatory settings or in nursing homes. And we want half of them to be men and half of them to be women. We want half of them to be older and half of them to be younger. And we also are going to what we call oversample, or we're going to include more minority participants than would be in the general population. So for example, Hispanics are about maybe 27, 28% of the population in Arizona. We hope to get them up into the high 40% in terms of studied participants. So we have a way of looking through the results of the antibody testing initiative and determining who fits in each of these cells, these little boxes, and in terms of, are you a female, younger healthcare worker, for example? Because we want to have a study population where we can answer many questions and not have everybody just in one category.
Any last questions? Okay, well, thank you so much for coming. And again, if you think of something, please follow up. There's a couple of media contacts on the news release, both for the study and for the antibody testing initiative. Thanks again. And again, the website to get more information about the antibody testing initiative is covid19antibodytesting.arizona.edu. And Dr. Burgess will have a website up, but there's also information in the news release about how to contact that group should there be additional questions. Thank you very much. Thank you. Thanks so much for letting us do this.
Absolutely. Good luck. Hopefully we can get the rest of the folks that you need to get this done.
Well,
So
we ramp this up and
get it working.